Hi, my name's Ed Hope. I'm a junior doctor in the UK, and this is my jargon busting guide to Chicago Med.
The pan scan showed his spine, chest, and belly were clear. However, his head CT showed diffuse bilateral intraparenchymal bleeding.
Okay, patient is confused, and rightly so. Lots of words to break down there. So diffuse means it's sort of well spread. There's not one area of kind of disease going on. We have bilateral, which you guys probably know means both sides of the brain. Parenchymal is just the general tissue that organ's made up of. So in the brain, it's all the neurons, so that's all it means there. And bleeding means obviously there's some blood within that tissue. So putting it all together means there's a big bleed going on all throughout the brain.
Anterior lateral ST elevations.
Damn it, cardiac ischemia.
One of your grafts must have went down.
Okay, you've probably heard the term ST elevation before, certainly in these medical shows, because it's a really serious medical emergency, something serious going wrong with the heart. An EKG, the electrocardiogram, where we do a trace of the heart. Well, remember that little line we see? We see it all over the place, don't we? Well, there's two waves in that trace, called the S wave and the T wave. Now, when between those waves that becomes elevated, we call that ST elevation. It's a really serious problem because it's a sign of a heart attack.
We need to brainstorm zebras.
So we need to brainstorm zebras. This is a really cool thing to put in actually, because it's a very common thing that medical students do wrong. So when you have an illness, or if you have a patient that's unwell, you don't think of the real random illnesses. So the way this has come about is that if you had a field and lots of hoof prints, what would you think caused those hoof prints? You'd think a horse and not a zebra. So you need to do the same thing as a doctor. We need to think of the common things and not the uncommon things first. But it sounds like they need to brainstorm the zebras, so therefore they need to think of the more obscure stuff, because probably the patient hasn't got the obvious things. I'm quite enjoying this actually.
Take over bagging. I need to intubate. 100 of sucks, 20 of etomidate. Fasten, Dr. Sexton.
Yes, ma'am.
Okay, so this patient's really unwell because there's lots of people around and they're struggling to breathe for themselves. So we're gonna have to intubate the patient. That's where we put a tube down the throat, and the bagging they're referring to is where we compress a bag to force air into the lungs because we have to breathe for the patient. Thank you so much for watching. I had a lot of fun jargon busting the phrases from Chicago Med, and I hope you did too, and I hope you learned something along the way.